last time on Let's Play Trauma Team, we had discovered that Joshua's had a relapse of gastric ulcers. So there's gotta be another disease that is causing this. Since he just had endoscopic surgery not too long ago.
You're having a relapse of gastric ulcers, which I'm guessing hurts a lot. Why do you keep trying to hide your symptoms from me?
There's nothing wrong with me. I really didn't notice.
You're full of shit.
Just stop it. There's no way you're all right. Now listen to me. I don't know why you're pretending to be fine, and I don't care why. But the more you keep this up, the more you make everyone around you worry about you.
But...
Whoa, there's no need to explain. If you don't want to talk about it, then that's fine. I've got permission from Lisa, I mean your mother, already. Roni, get the examinations ready. If he's not going to talk, then I'll find out myself.
Understood. Doctor, please calm down.
Right, he does have to remain professional with patients, even if they're related to him.
The X-ray, CT, and analysis exams are now available.
Well, I guess I've got a lot of images to look at, but since he's not going to talk... Oh, right, numbers. We didn't have any numbers last operation, so... I guess we've got a bunch of them here. Now, one neat little thing you can do is if you click on the name of the heading, you can actually see what disorders values outside of the normal level would cause. Like, yeah, like that. So let's take a look at these. Serum amylase is a little high.
Serum amylase seems unusually high. Roni, add that to our list.
Understood, Doctor. New symptom observed. High serum amylase level.
His serum lipase is really high, too.
His serum lipase level is a bit higher than I'd like it to be. Roni, record that.
Now, both of these being high are indicators of pancreatic disorders, so I'm guessing we're going to have to take some pictures of his pancreas at some point. As the elastase level is high too, that's another indicator of a pancreatic disorder.
His elastase level is elevated. Roni, you got that?
Understood, Doctor. New symptom observed. High elastase level.
Now, I would post the descriptions of all these headings, but that would be better off as a screenshot Let's Play, and I don't want to throw walls of text at people. I'm gonna just double check the numbers, make sure I got everything. Yep, that's everything. So now I've got a bunch of images to take a look at. 2 tests.
Doctor, the X-ray and CT results are ready for you.
Let's take a look at them.
We'll see if there's anything obvious in any of these images, or I'll take them. That's a lot of CT images. Is there another air fluid level problem here?
There's an abnormal break in the bowel gas. Roni, record that.
Understood, Doctor. New
Oh, that's in his
symptom
large
observed.
intestine.
Abnormal bowel gas in intestine.
Okay, now these CT images. What do we got here? I'm not seeing anything at first glance. Okay, yeah, I'm just gonna have to take a look at all these images myself. So I will be right back. Okay, we're back. There's two differences I found. One is in the third image, where, as we suspected from the high serum levels, he has a pancreatic disorder. Well, if you look in the third image, his pancreas is swollen.
Well, this isn't normal. His pancreas is swollen. Roni, make a note of it.
Understood, Doctor. New symptom observed. Swollen pancreas.
We've got a lot more to go off of now.
Doctor, we need the patient's cooperation for any further examinations.
Yeah, you're right. I should try talking to him again.
There's one more difference I found in the fourth image. He's really... Joshua's really thin. He's been losing weight, so there's less fat up here.
That's a pretty thin layer of fat. Is it possible this disease has been ongoing?
Doctor, I would like to remind you that it is still within the normal range.
I know. I just want to cure him before he gets any thinner.
I agree, Doctor. Let's continue with the diagnosis.
Huh. So I guess that wasn't a symptom after all. In any case... hopefully he'll cooperate with the exams so we can further diagnose him.
Well, I may have been a bit harsh earlier. I wasn't being professional. But you also...
Doctor?
I know. Just be quiet. Anyways, I want to cure you completely. And everyone is worried about you. Joshua, will you please cooperate with the exams?
Sorry.
Huh?
I'm sorry. I'm sorry.
Hey. Hey. It's all right. Don't cry.
But it's all my fault. I didn't want my mom or that nurse to worry about me.
But you made them worry about you even more.
Joshua.
I'm really sorry. I just made everyone worry even more. I won't hide anything anymore. I want to get out of this hospital. So, please.
Yeah, I understand.
Actually, my tummy feels a little weird. Can you check it out, Doctor?
Of course. Leave it to me. Roni, are you ready?
Yes, Doctor. I am fully prepared.
All right, let's continue the exam.
That's actually pretty common for young people to try to hide things so that people don't worry, and then it makes people worry even more. I've done it before. I'm sure all of us have.
I'm sorry that I lied all this time. It's not just my tummy. My back's been starting to hurt too.
Back pains at this age?
Back pains. His condition must be getting worse. Roni, make a note.
Understood, Doctor. New symptom observed. Back pains.
I mean, I'll get back pains every once in a blue moon, but not too often.
It doesn't hurt so much that I can't bear it, but it hurts a lot. Also, I don't feel well. I feel like I'm gonna throw up any minute.
That's a terrible feeling.
He feels like he's going to vomit, huh? Sounds like he's finally telling the truth about something.
Thankfully, I haven't had to vomit in years.
New symptom observed.
I've actually been pretty lucky. I haven't really gotten sick in a year and a half.
If there's anything more, I'll tell you right away, Doctor.
And I feel really blessed because this flu season was one of the worst in history, and I dodged all of it despite working at a hospital where there would be people with the flu. I guess that does tell me. That does tell me something. I guess when I did have my blood pressure taken the second time, I guess they were a little bit worried that it was on the high end of the normal range, but it was still in the normal range. Did anything change on the diagnostic? I don't see anything that changed. Oh. Can I diagnose him yet? No, he would not have jaundice. Chronic pancreatitis. Nausea. Elastase, lipase, amylase. Calcification, we don't have that. So is it acute pancreatitis? Okay, those are right. Swollen pancreas, abnormal bowel gas. What are we missing? We're missing blood spots. Okay, I gotta look at his stomach again. I knew I was forgetting something.
Ah, Joshua. How are you feeling? Are you alright?
Oh, Doctor. Yep, I'm still doing okay.
That's a good boy. Just hang in there a little longer.
Alright, let's take a look. Yep, they're both there.
Hemorrhaging spots on the left side of his abdomen. Roni, put that in his record.
Understood, Doctor. New symptom observed. Blood spots on left of abdomen.
So they are separate symptoms then.
Hemorrhaging spots near the navel. Roni, write that down.
Understood, Doctor. New symptom observed. Blood spots near navel.
Alright, that should be everything we need to diagnose him.
Well, we have his symptoms. Roni, let's narrow down our diagnosis.
The only puzzle in this was getting him to use his hands, and I managed to solve that in a few seconds. I mean, other than obviously doing pixel hunting, but that takes time. Blood spots, blood spots. So it is a pancreatic disorder.
Acute pancreatitis. But I find it hard to believe this could have caused the relapse of his gastric ulcers. Damn it. There's still something else. Roni, I'm continuing with the diagnosis. We're not done yet.
Indeed, Doctor. I will follow your lead.
So now we gotta dig even deeper into him.
Acute pancreatitis? That can't be the primary disease.
It is plausible the chief illness caused it, like the ulcers.
What the heck's going on?
We can only hope our examination will answer that, Doctor.
Yeah. I hate dealing with all these complications.
But we're gonna have to find out what the primary illness is, hopefully, next time.